can speak literally for hours about the impact this aggressively absurd, blasphemous, morally bankrupt bill will have on various marginalized communities, from racial minorities, ethnic minorities, to our LGBT community, to veterans, just about anybody. But I wanted to speak specifically to the Appalachian region because I received my undergraduate degree from Appalachian State University. Yeah, real news. I worked in Boone for a homeless shelter and worked with residents from Watauga to Wilkes, Allegheny, Yancey. And unlike a lot of the politicians in our media, I don't invoke the Appalachian region to simply undermine the economic tribulations that other groups face. I actually genuinely care about the Appalachian region. And so I wanted to focus a little bit about the impact that this can have, not just on the Appalachian region, but rural communities in general. Rural residents are disproportionately on Medicaid. This insane slashing of Medicaid will rob healthcare for so many of the people living in those areas. Rural hospitals are highly likely to be closed. They're already at risk of closing. They've been at risk of closing. And in Watauga County, for example, near where I worked, we only had one hospital. And so imagine the compounding effects of that hospital being closed. That means other hospitals will have increased wait times. That means people will lack access, both they'll lose providers, people who don't have access, consistent and reliable access to transportation will lose any means of receiving healthcare. Most people, or a disproportionate amount of people in the Appalachian region and in rural areas in general are more likely to have chronic illnesses as well. And I also wanted to briefly acknowledge how trifling this bill is and the way that it will really just steal money from those of us who aren't billionaires, who aren't making upwards of $500,000. Even surgeons generally don't make $500,000. What we do know is that this bill will slash over $1 trillion from Medicaid and SNAP and will be one of the most enormous upwards transfer of wealth to the billionaire class, to people who make unfathomable amounts of money. And I want to implore everybody to even just Google what wealth in scale really looks like. I don't think most people, because it's unfathomable, realize how egregiously high $1 billion is.